Hello, Professor Hart. This is Cynthia Booker. My video journal reflection this week is I had the opportunity to speak with a 19-year-old female navigating a complex psychiatric profile such as attention deficit hyperactive disorder, generalized anxiety disorder, mood disorder, depression, and eating disorder. As she prepared to re-enter college, her story illuminates the subtle way relational stressors and internalized expectation can trigger anxiety. One moment that stood out to me, her distress was over a delayed text from her roommate. Though the roommate later acted as if nothing was wrong, the patient anxiety had already spiraled down. The moment reminded me how deeply validation-seeking behavior are woven into emotional fabric of young adults with anxiety and mood disorders. Understanding the psychopathologic and the psychiatric mental health nurse practitioner role. This interaction deepened my understanding of the NP role in helping patient reframe interpersonal experiences, advising her to accept others as they are rather than seeking constant reassurance was the therapeutic pivot that emphasizes emotional flexibility. It also reinforced the importance of psychoeducation and around cognitive distortions, especially in patients with multi-comorbidity conditions. Her medication regime was Vyvanse, sertraline, lamotrigine, and Buspar. Reflect a layer of pharmacological approaches, and her stable mood suggests partial efficacies. Still, her poor appetite and food preference signals ongoing challenges with her eating disorder. To better understand the interplay of these conditions, I found identifying depression and anxiety in teens with ADHD. That was a book. It also explores how attention deficit hyperactive disorder can amplify emotional dysregulation and complicate anxiety presentation. Other books recognize and treating comorbidity conditions such as anxiety or ADHD can offer a practical strategy for managing overlapping symptoms, which I'll be integrating into my future assessment. Therapeutic use of self, strength, and limitations. One of the strengths in this session was my ability to validate her emotions without reinforcing maladaptive patterns. I use a gentle reframing and reflective listening to her to help her explore the difference between perceived rejection and actual interpersonal dynamics. However, I noticed a limitation in my initial hesitation to address her sleep schedule. I worried it might be judgmental, but I since realized that compassion inquiries the part of therapeutic alliance building in a future session. I approach lifestyle patterns with more confidence and curiosity. Reflection of an application, eating disorder, and identity. Her aspiration to become a cook despite her current eating challenge was a powerful moment. It reframes her eating disorders as just not a struggle but a potential source of growth and identity. I carry this insight forward by helping the patient identify strengths and future goals that coexist with their diagnosis. A final takeaway from this encounter, I learned that the therapeutic programs offers lies in a small reframe, helping the patient shift from seeking external validation to cultivating internal stability. In my future practice, I'll become intentional about exploring relational triggers and using psychoeducation to build emotional resilience. And I'll continue to reflect on how my own present calm, curiosity, and non-judgmental can be a healing tool in itself. Thanks for listening.